As you know, I practice as a radiation oncologist, and I have instituted a 7-pronged approach to treating cancer patients, not just using radiation oncology to ablate the cancer cells, but also to address the psychological toxicities that accompany the diagnosis of cancer. But not only the psychological toxicities, but emotional and spiritual. So the Big C Beatitudes was created and instituted in my clinical practice by me to address all of the aforementioned issues associated with the cancer diagnosis. And the Big C Beatitudes is ascribed an acronym, HIS LAMP. That's HISLAMP. So the RE is actually the institution or the enactment of the element or the attitude. And then the attitude is itself the factor, the attitude that we want to instill with the Big C Beatitudes. So again, the H is restoration of hope. The I is reclamation of identity. The S is the reaffirmation of self-worth. The L is the reappraisal of life. The A is requited admiration, as in patients admire us as physicians, and we admire them for the tenacity and courage, the strength it takes to endure radiation, chemotherapy, just the diagnosis of cancer, and to move forward in life nonetheless, facing all the other challenges that life presents to us on a daily basis. And then the M is the rehabilitation of the mind. The P is the reignition of purpose. And so his lamp, again, is a 7-pronged algorithm. And as us believers know, 7 is the number for completion, biblically or spiritually. Or patients come from different walks of life. And when they present with cancer, they have a certain narrative in their minds about how this will play out. They've already formulated an impression of what their life will entail moving forward. And many patients lose hope. Many patients believe that there is no brighter future for them. And so we, as physicians, treating just the cancer, we do not address all the psychological warfare, the ruminations and perseverations that are daily plaguing our patients' minds. And so the Big C Beatitudes was instituted for that reason. It is my belief that fusing the two, having the Big C Beatitudes infused in the actual clinical practice setting versus separating psychological counseling, spiritual counseling from my treatment with radiation, my treatment of the actual physical tumor. I believe that fusing is indeed more effective. Again, because as human beings, we tend to compartmentalize. And so in doing so, patients do not then fester, they do not develop this infection that is not being treated, the psychological infection that just festers and becomes an abscess that then is no longer, and I'm using an analogy here, a medical analogy, where an infection can then grow into or progress to become an abscess, which then requires a procedure to incise and drain. What we want to do is we want to address the infection with an antibiotic before it progresses to an abscess. And that is the analogy that I use when I state that I fuse the two. I employ, utilize, I implement the big C attitudes in my practice, along with the actual medical interventions, in my case, radiation, such that the whole patient is treated. And this, again, has been extremely effective, and my patients have many times, countless in reading my books, but also in practice. At the end of each patient's treatment, there is the tangible, if the patient does respond, and then there are the numerous intangibles that we discuss, so much that they have gained the collation of the culmination and collation of all of the amalgamations, tangibles, intangibles, big C attitudes, and treatment. We discuss them and we move forward. And even in follow up, we are still reaping the benefits. We are harvesting the institution of the big C attitudes.